Secondhand smoke gets all the attention, but what about its sneaky little cousin? Let's sip on some tea on third-hand smoke and why it's important to include this in every asthma education convo. Hi guys, welcome back to RTs Share Tea, where respiratory therapists live out loud. With me, your host, Linda Fry, the asthma lady. Yes, welcome everyone. Welcome to anyone new. And I am back from vacation. I had to take some time for myself. That's it. But very excited to be back with you guys. I want to give a special shout out to my last guest co-host, Dr. Ellen Becker, where she dropped the gems on sponsorships, right? So if you want to check that episode out, I will have that in the description. So today we are going to be talking about third-hand smoke and how to talk about this with patients in regards to asthma self-management. People, for the most part, know secondhand smoke exposure dangers, right? So they know how this is an issue for those of us who have asthma or any type of other respiratory condition, right? So secondhand smoke is not a big mystery. The mystery is behind third-hand smoke. And I want to explain to you what that is in as simple as possible. So third-hand smoke is the smoke that lingers behind after someone smokes a cigar or smokes marijuana or smoke anything that is lingering in the air. So this stuff, this smoke, is what's attaching to your furniture. So third-hand smoke is smoke that sticks around. It doesn't go anywhere. And we have to understand why it's important to talk about that, not just secondhand smoke exposure, especially when it comes to children that have asthma. You have to understand, when we ask the question, does anyone smoke in the home? In high-risk areas, we often hear answers like, yes, but I don't smoke in the kid's room, or I don't smoke around the child that has asthma. You understand? And not fully understanding the dynamics of third-hand smoke. So once again, third-hand smoke is what sticks on to your furniture, your surfaces. So it's on your walls. It's circulating in the air that you're breathing, the air quality in your home, and it's attached to you, the person. So it's attached to on your skin, your nails, your hair. It is attached to you. So understand, parents who have, even if they are not the smoker, if someone smokes in the home, we have to understand that the child is still exposed to third-hand smoke. And if the parent or the caretaker is the one with the smoke, especially with small kids, know that every time you pick that kid up, they are inhaling the smoke from your hair, from your clothes, from your skin. So that's why it's important to talk about third-hand smoke and how it lingers in the home. And know that it can stay in your home for weeks, months, if not years, depending on how much smoke has been exposed in the home. And did I mention it can also combine with VOCs, vital organic compounds. And I had an episode on how to deal with vital organic compounds a little bit ago. I will also attach this to this episode, but know that all this stuff, right? So just particles, chemical particles that are just in the air quality, in the air that you breathe in your home. So now you have VOCs and you have smoke combining in the air, and know how that can contribute to asthma getting worse or asthma continuously being triggered. So third-hand smoke, talking about third-hand smoke is a teachable moment because there's a huge knowledge gap around this topic. Okay, first, let's talk about it in a way where we don't lose patient engagement during the asthma education session. We always want to start with empathy and start the conversation on that tone, understanding where patients are today, right? So knowing that they are in some shape or form doing whatever they can to protect their family, especially when we are talking about children with asthma. We also want to normalize the knowledge gap, right? So something like, listen, Miss Jackson, I'm gonna tell you, for real, a lot of people don't even know about third-hand smoke. Trust me, you are not alone. Yeah, so let them know they're not alone. It's not just them. This is something that is a standard for the common person to not fully understand what third-hand smoke is. You can use everyday examples and visuals to help them understand why it's a miss. You can use something like, grease stains that's in the back. That's on backsplash. People don't see those things often, and it's often a miss. Things like dust particles in the air, you can't really see that, so understand why that's a miss. So just giving them something that they can visualize, and it helps them to not feel bad or shameful. You know what I'm saying? So let them know that this is a common miss. So what we want to continue to do is focus on empowerment and not shaming when it comes to dealing with secondhand smoke or third-hand smoke. Does anyone smoke in the home? The graphic here says if it's a no, we say great. Thank you for sharing that information. Well, thank you, Ms. Jackson, for sharing that information with me. Please continue your no smoking policy in the home and call with visitors, right? So we want to make sure everybody's following this policy. So that's how we state it. And we let patients know that they can always come back for us for smoking cessation resources at any time if anything changes. So let them know they can always come back to you. Okay, now here's the question. If it's a yes, does anyone smoke in the home? If it's a yes, we ask the patient if they have considered making their home smoke-free. That's it. Have they considered creating a smoke-free policy in the home? If they say yes, then we address barriers and provide linkage to resources. So this is when we would provide things like quit smoking hotlines or any other additional programs, outreach programs, anything that we can link them for resources. If the answer is no, then we provide education on the third-hand smoke, which is what I just mentioned. So knowing that this is a knowledge gap and it's a teachable moment, and you might get the aha moment. You might get that look like, oh snap, I didn't even think about that. And from there, we can encourage them by giving them actionable steps, things that they can actually do if third-hand smoke is an issue for them in the home. And we can start to mention things like potentially getting whoever the smoker is, maybe they can consider getting a smoke outfit and smoking outside of the home completely, right? Not just avoiding the child's room or just smoking in one room or just their room, meaning we want you outside. Okay, smoking outside and having an outfit specifically dedicated, or outfits specifically dedicated to go smoke. So something like a tracksuit, they can go on Fashion Nova, whatever, get them a nice something cute, get them a smoke bonnet. Remember, smoke attaches to the hair and the skin, so they can put something on their hair, right? The beautiful hair that we take care of. They can also, like I said, get the outfit, smoke outside, and when they come back, make that it's something easy to remove and hang up in the very front, or put in a plastic bag, throw it in the wash, and they immediately wash their hands using something like an air purifier. And know that if an air purifier is not within the budget, they can create their own air purifier. There are plenty of YouTube videos on how to create your own DIY air purifier, and you can use a $20 box fan and purchase some filters on Amazon, which are relatively cheap, and create your own air purifier if your patient is a DIYer. So give them options, to encourage them to go in this direction, and you will keep them engaged. Trust me. All right, guys, so that's all we got for today. Please, start to have these dialogues on hidden asthma triggers. So this trigger is a sneaky one. It's not one that we talk about often, but you have to understand, most of us spend a lot of time at home, right? So indoor air quality, especially in the home, is very important for those of us with asthma, and our patients must know that as well. So yeah, guys, let's keep the conversation going. Put in the comments, have you had any issues talking about secondhand smoke? Have you ever had to address third-hand smoke? Have you had a positive or negative reaction? Let me know. Let me know if the vibe is the same for you. All right, guys. So I just want to say thank you so much for being here with us. Know that we are here every Wednesday, except for when I'm on vacation, on most podcast platforms. And we are on YouTube on Thursdays, guys. So look for us on your favorite platform, streaming platforms. I said that backwards, but you know what I mean. So yes, guys, I hope you are enjoying your summer. I hope you enjoyed your 4th of July. All right, guys. So I'll see you next week. Bye.